All right, for part 2 of the low back and hip fix video, we're going to dive into the muscles of the front of the hip. So that's your hip flexors and your TFL. Both of those muscles can cause pain in the low back. They can cause pain to shoot down the legs, and they can cause pain just in the front of that hip as well. So if you're experiencing any of those, it's worth giving this a try. The first trick for kind of releasing the front of those hips is actually releasing the quads themselves, and we're going to move on to the hip flexors and the TFL. We're going to start doing that by rolling out on our trusty foam roller. We're going to start with the quads down by the knees. We're going to work our way up to the hip flexors themselves. So how that looks, we'll take our foam roller over down on the ground there. Starting with that roller right up past the knees. And what we're gonna do is just kind of roll back and forth the whole length of those quads. So we make sure our stomach's pretty tight. We shouldn't be feeling any pain in our lower back here, but we should feel some tension and some kind of pain in those quads because a lot of times they're gonna be pretty tight, pretty irritated. So if we get on this foam roller and we're feeling it, don't be scared, you're not gonna do any damage. What we are gonna do is release those quads and release that tension upstream. So roll back and forth, slowly breathing and relaxing, and we're just gonna kind of roll the whole length of those quads or the front of the leg. We're also gonna play with kind of rolling to the inside of one and the outside of the other, back and forth for a few passes, and then we'll roll to the opposite side for a few passes as well. Now, we can hit that for probably 2 to 4 minutes, depending on how tender they are. We want to get in there pretty good. Now, once we're done with the foam roller, we're going to move on to those hip flexors. And for that, we're going to use our massage stick. So we can, usually I kind of lean up against the wall, but we're just going to sit down on our butt. And we're going to take this stick, and we're going to kind of roll through that TFL and hip flexor. So basically, that's this area right here, kind of where our pocket's located on our jeans. Again, if you can lean against something and kind of really relax, it's going to make a big difference here. But we want to dig in with that stick and kind of roll through all of this tissue like you're kind of kneading bread. Getting in there, digging nice and deep. And if we find anything that's super tender, as usual, we're going to put a lot of pressure on it. We're going to dig pretty deep, and we're going to breathe and relax. As far as the stick goes, get about 2 minutes each side. If you find anywhere, like I said, it's pretty bad, focus on that area for at least 30 seconds, and then we can kind of move on. Also, hit both sides. And lastly, if you're still feeling pain in the front of those hips or anywhere kind of we talked about earlier, we're going to move on to our Supernova. Again, you can use a softball. Anything about this size as a hard ball will work, but we're going to target those same areas that we were just targeting with the stick, but now with the ball and now with our body weight, so we can actually put some, a little bit more force in there while we're relaxing a little bit more as well. So we're going to locate that same bit of tissue. If you found somewhere with the stick that was super tender, let's start there. We're going to put the ball right on that spot, and then we're gonna just kind of hunt around for the most painful spot. We found it right there. Now we're just breathing and relaxing. We'll spend about 30 seconds to 45 seconds on the spot itself without moving, just breathing and relaxing, preferably in that belly, not the chest. And then we'll start kind of rolling around a little bit and massaging out that tissue very, very, very slowly. So these spots can be super tender. They can get really bound up on people. Especially people that are on their feet all day. So we're gonna target that TFL, find it, sit on it for 30 to 45 seconds, then slowly roll around and massage that tissue until it releases and relaxes. Again, give that a try on both sides. If you're feeling it really bad on one side, spend most of your time on that side, but it's always good to check both. A lot of times we won't actually feel pain until it's at about 60%. So if we want to be functioning optimally, we'll release both sides and you should be feeling pretty good. Thanks.